Hello, everyone. So, in the post COVID world, we need to ensure that mental well being is prioritized across sections of society. Honestly, mental health has been prevalent much before this pandemic or before our Bollywood celebrities openly spoke about it. For centuries, many have suffered in silence as speaking about mental health issues was and continues to be a taboo. Not anymore. Joining the mental health revolution in India, She the People is back with the second edition of its mental health summit, Reframe, powered by Colors, which aims to question our stigmatized gaze and to normalize not being okay. Today's panel is titled Mental Health and Hormonal Health Are Linked, is curated by Gytree, a platform building a comprehensive healthcare ecosystem for women. Gayatree's approach is preventive, that is, tackling symptoms first. They provide a holistic experience with consults and science backed programs and are backed by a team of judgment free and experienced health experts. And in today's panel, we have three of these amazing doctors. So let me introduce to you Dr. Sudeshna, a gynecologist with 24 years of experience and medical director of Gytree. We also have Dr. Vaishali Sakpal, a gynecologist specializing in hormonal health, and Rhea Dubey, who is a psychologist specializing in mental health issues related to grief, adolescence, and relationships. So let's get started. Dr. Ray, my first question is for you. What is the role of hormones in mental health?
Thank you, Kareshma. Thank you for making me a part of this panel, the very important panel of relating hormonal health and mental health. So, of course, hormones play a vital role in stabilizing the mental as well as the emotional health in an individual. It is seen in men too, but more pronounced in females because of the daily fluctuations, phasic fluctuations of the hormonal levels. Certain hormones like cortisol, dopamine, serotonin, these are very essential to maintain the mood stability, to maintain sleep, to help digestion. All of these are very, very important parts of keeping up to the adequate mental health. On the other hand, the hormonal imbalance, any imbalance between the level of the hormones that is there are so many hormones in our body, and they all work in a perfect balance. Any imbalance in any of these hormones can also lead to anxiety, depression, restlessness, again, causing mental health issues. So, of course, hormones are definitely a part of, closely linked to mental health of a woman.
Okay, so that you've mentioned that there are certain hormones that are linked to mental health. So, Dr. Sakpal, would you like to tell me, is there any stage in a woman's life or stages for that matter where these hormonal fluctuations are maximum or they impact the most?
So, talking about the mental health and the effect of the hormonal changes on the various stages of life. So, a woman undergoes changes throughout her life. There's always some changes in social life. At the same time, the changes also take place in her physical health. So, let's go there one by one. So, the first change which comes in the life of a woman is during her puberty. So, puberty is the first time when there are a lot of hormonal changes occurring in your body. Okay, like puberty is a stage of transition from childhood to adulthood. There are many new hormones coming in, the older ones are increasing amount. All these hormonal imbalances puts a lot of stress on the children, especially the sex hormones, the stress hormones, and the adrenal hormones. The three hormones play a very important role during puberty. Okay, so estrogen is a hormone which is secreted in the females by the ovaries. This hormone, estrogen, is very important for the level of serotonin, maintaining the levels. But during the initial stages of establishing the menstrual cycle, the hormones are, they are little unstable. By the time it gets stable, it takes little time. So first 2 to 3 years, they are little unstable. And this instability can cause If the estrogen levels are low, it affects the serotonin levels, which can lead to anxiety and little sadness, depression. At the same time, if the estrogen levels are very high, then it can cause irritability in these kids. Also, a chronic stress. Now, the kids nowadays, they are subjected to many competitive exams, and they have a lot of pressure. So chronic stress will also affect the cortisol levels. So this cortisol levels eventually will affect your insulin level and glucose level, which again is going to affect your serotonin level. So increased chronic stress is not good for them. It causes, it is like a way for a chronic depression later in life. At the same time, sustained cortisol levels will also lead to increased secretion of adrenaline, and this can lead to adrenaline anxiety in the in the adolescent age group. So this was about the puberty. Okay, the second
Can I add something on the puberty part? So when these hormones work on the brain, the same hormones have different effects in men and women. So the parts of the brain that they affect in the man, in a boy, is different from the part of the brain that is affected by the hormones in a girl. So that the response to an emotional event is very different right from the puberty, because the hormones have effect on different parts of the brain. That is also a very important thing to note, that why the response is so different in men or a boy, starting from the boyhood to the woman, because it's the hormones that play the major role in creating that kind of stress response. Yeah, Vaishali, please.
Yes. The second part is during the reproductive years. So once the girl has attained her puberty, after a few years, she's going to stabilize with her hormonal axis. And there is this normal reproductive age group. Now, during this time, during your normal menses, also there are regular fluctuations in the estrogen and progesterone. Like in the earlier part, the estrogen is high. In the second part, the progesterone is high. Now, this orchestra of the estrogen and progesterone also have effects on your brain, on your mood swings. So some females, not some, actually it is a more common thing, wherein they suffer from premonitory syndrome. There is a thing called as premonitory syndrome, and they suffer from, the symptoms are like bloating, breast tenderness, and mood swings. Now this is a little milder form. Okay. Now around 3 to 8% of females, they however they're very sensitive to these fluctuations, and they may have severe mood swings, extreme level of mood swings, to the extent that they can have severe depression. And that condition then is called as premenstrual dysphoric disorder. Now it is very important to differentiate between these two, because the line of management is also different, and also the PMDD, which we call premenstrual dysphoric disorder, it is a severe condition. It needs to be addressed as soon as possible. So if you find someone like this, you do consult your doctor, because this severe depression can lead them to suicidal tendencies also. So this is not good. So this is the second stage. Then the very important stage next in a woman's life is during her pregnancy, especially the first to be moms. Now, during pregnancy, there is a drastic change in the hormone levels. There is very high surges of estrogen and progesterone. Now, these two hormones, they're very essential to continue a pregnancy. But at the same time, they all act on all your different parts of your body, and they're definitely going to control your brain activity also. Okay, so since estrogen acts on brain, certain areas of brain, it is associated with anxiety, depression. At the same time, the progesterone hormone, it loosens your muscles and joints to prepare you for labor. But at the same time, it can cause, sadness or sluggishness or fatigue. These symptoms can be caused because of progesterone. So during pregnancy, you may find that the females can be in the, they're at the extremes. Either they're very happy, they're very joyful, and at the other time, they don't know, they're suddenly sad. There is an outburst of anger. You don't know why it's happening. Now, all this is because of estrogen and progesterone. So let's not So let's not you know what, let's not stigmatize this, that this female is very cranky, she's very dramatic. It's not like that. There are many other things.
Let's not judge them. Let's
Let's
not
not
judge
judge them. Yes.
that. I never had a problem in my pregnancy. So most of the relatives around will say, I never had this problem. So every pregnancy is unique. Every pregnancy hormone, maybe they're the same hormone, but the response to the same hormone can be different in different women. So
Yes.
it is very important to understand that not all women, whether they are going through the puberty or through the pregnancy or through any kind of perimenopause, are the same. And even with the same hormones, they have different effects because they have different brains. Everybody has the responses different, even if the chemicals are the same.
Yes, ma'am. Then there are other factors also which contribute to this mood swings during pregnancy, like the social factors, then the stress and anxiety which she has. Anxiety, especially the new moms, they have anxiety regarding how will be they able to take care of the newborn, how will be their labor, will be they able to tolerate the pain, what will happen to their perineum. So all these anxiety are different in different females, and we should not judge them depending on this. However, if you find like the symptoms are uncontrollable, like you are feeling very depressed or very anxious, which is not getting relieved by any other uh, method, then you should consult a therapist and take help of a therapist. Just not let it go like nahi ye to hota hi hai, aise chalta hi hai. You should not do that. So after pregnancy, the next stage where the hormones again start become haywire is during postpartum period. Immediately after delivery, once the baby is out, the placenta is out, the two important hormones which we are talking about, the estrogen and progesterone, there is a sharp fall in them. There is a sharp fall in the blood levels of estrogen and progesterone. And it has been seen that during this sharp fall, there are increased chances of developing postpartum depression. So whenever the studies have shown that postpartum depression is more common. There are certain females who are more sensitive to this fall in the hormones levels to cause postpartum depression. So postpartum depression can develop within, up to 4 weeks after the delivery. So, and it is characterized by, sadness, depression, feeling of unworthiness, suicidal feeling. Then there are postpartum blues. Now, postpartum blue is something different. It occurs during the first 7 days post delivery, and it is, it is just mild dysphoria, which you can alleviate with the drugs the doctors will give. So it is not of more, not much problematic than the postpartum depression. And there is something different, postpartum psychosis. This is a totally different condition in which it is a rapid onset, and there are hallucination, there are delusions, there is abnormal behavior. But this condition is more severe. Whenever this condition occurs, you have to be very careful, because that mother can harm the baby also and herself also. Okay? So all this in the postpartum occurs because of fall in the hormones, that is estrogen and progesterone. So we saw this postpartum depression when the hormonal changes are maximum. Then the next stage, which comes in every woman's life, is during the perimenopausal and the menopausal period. When again our two friends, that is the estrogen and progesterone, they start falling. The levels will start falling. It will not start immediately. Before you get your menopause, 4 to 5 years before the onset of menopause, there is a gradual fall, and then they are going to fall. So whatever functions which are done by these estrogen and progesterones, they are going to lessen and lessen. And one of them is to maintain your mental health. So obviously the
Mood stability.
mood stability. So postmenopausal women, or in the women in the perimenopausal group, they are more, they have a tendency of having mood swings. Like, they are more irritable. Then they also have night sweat, hot flashes. That also makes them more cranky during this period of life.
Sleeplessness.
Sleeplessness, yes.
So thank you, Dr. Sakpal. So we've just learned through the various stages that you've said. To simply put, that we have puberty. It starts with puberty, moves on to your menstrual age, then moves on to your reproductive age, pregnancy and postpartum, and then we have menopause. So, ladies, girls, when you don't know what's going wrong, blame it on your hormones. So we've just understood the stages and also how it is impacting our life. So, Dr. Sudesh, if you can tell us, like Dr. Vaishali has already told us how it's impacting our life during all these stages. But when, should we, so sometimes we consider it's normal, right? As she said, कि ये part है, hormonal fluctuation हो रहा है. But when do you think it starts impacting our quality of life and medical intervention is required?
Right. Thank you. That's a very important, very nice question, because, we all live, but it is very important to live happily, to live with quality. So the quality of life is one of the most important aspects of contemporary healthcare, and anything that affects the quality of life needs attention. And here we are having a discussion on hormones affecting quality of life, which is very, very pronounced in certain stages of life. When we talk about natural, whether it is a natural phasic fluctuations of hormones or whether it's a hormonal imbalance, both can have a profound effect or impact on the quality of life in a woman. This, the hormonal imbalance in women is very easily understood in puberty and pregnancy. People accept those changes and those reactions to changes or the responses to changes far more easily than around menopause or than around the midlife of the women. So starting from the 30s till around menopause, these hormones can really affect the quality of life, which makes the world around her a little difficult to live in. So in the 30s, she might have more pronounced PMS, the one that Dr. Vaishali was talking about, premenstrual symptoms. So apart from the physical symptoms, there's a lot of anxiety, depression, anger, irritability, sense of hopelessness. So all these are coming almost for about 5 to 7 days every month, and that really affects their lives and, as I say, the quality of life, the way they live and the way they interact, their social interactions, their personal interactions, even self-care. So it affects all. Similarly, around menopause, there's a lot of mental symptoms. The depression is, statistics show that the depression rates increase by almost twice. It doubles around the perimenopause. So it can come as a new symptom. It can also be a resurfacing of a mild past symptom with a far greater intensity. Apart from this, there's a lot of, in the perimenopausal age, there's a lot of effect on the hormonal fluctuations that Dr. Vaishali was talking about, that the quality, the estrogen and progesterone are two great friends. Their quality change, they shift. So this shift in the hormonal level can affect the cognitive function of a woman. So she might feel that I'm not able to concentrate, I'm forgetting things, I'm confused, I'm being slow in my thinking. I was never so slow in my thinking. So these are real symptoms that is affected by the hormones. So it is not in the woman's control. Everybody thinks that, it's a stigma. Oh, this woman, she's going around menopause. So typically, but this is not, yes, we accept that it is perimenopausal, but it is also not to be judged. It is also not something which the woman has a control on. So sometimes the support that we need from our colleagues, from the family is very, very important. That is needed. So coming to the coming to answering the questions of the quality of life, yes, both hormonal imbalance as well as natural physic fluctuations in hormones can affect the quality of healthcare. And believe me, this is a very important part of, we have societies that deals only with perimenopausal women, only with menopausal women and mental health, where regular symposiums are happening. And as I said, it's a very important part of contemporary healthcare. Coming to the medication part of it, or needing medical help. So needing medical help always does not mean that you have to go to a doctor. I mean, you have to go to a doctor to get medications. You have to go to a specialist. Maybe your general practitioner, maybe some kind of a medical expert in the family who can guide you to the right person to go to. That's the first important step that one needs to take. The second, the first important step is awareness. So it can be either through your self-reading or through a medical expert in the that you can relate to, or that who you can confide. So that's the first. Second is the guidance that you need to go to the specific specialist. So whether it's a gynecologist that you will go to, whether it's a therapist you will go to, whether it's counselor that you need, or you need a psychiatrist. That kind of assessment needs a medical expertise. It cannot be happening through the family members, or through the non-medical family members, or through the community that you are in, or through their friends, or through your well-wishers. How much ever the well-wishers are, they're all trying to help you, but they will lack the medical expertise that you need. So when you need to seek medical help is when the symptoms, because of the hormonal levels, is affecting your self-care, it's affecting your work, and it is affecting your relationships. So these are the three things that one needs to be very, very careful about. If this happens, it's time to seek help. And that, of course, most of the help is in form of changing the lifestyle, changing a little bit of modifying the lifestyle with diet, exercise, yoga, deep breathing, relaxation techniques. But some women, in spite of all of these, will need medications. And there is absolutely no shame in taking those medications. It does not make you mad. It just gives you a sense of well-being, which is important. This hormones phase is going to stabilize at one point of time. But what you need is to respond at the right time, so that the mental stability is again regained. It's like, going off the track and then coming back into the track again. So whatever it needs to bring you back to the track, whether it's lifestyle modifications or medications, it is important to accept that. Don't deny, don't keep yourself in denial that I would not need medications, I would not take medications. If it is needed, if your expert medical help feels that you need medications, absolutely no shame in taking that.
Thank you, Dr. Sudeshna. You very beautifully articulated this, that how we need to pop those pills if required when the hormones start affecting our day-to-day life and it becomes difficult to carry on each day. Then let's just go to an expert rather than relying on our family, communities, and all. Yes, as you said, they're important, but medical intervention is very much important to make a new start. But on that note, as you said, that some things can be managed, and there are times then medical intervention is not required, but we have to make certain modifications in our lifestyle. So if Dr. Vaishali, you can throw some light on like what are these lifestyle changes or home remedies that we can use in our life that can help us in this fluctuating journey of hormones.
Yeah, hi. So, there are certain things which we can do at home. We can manage to a certain extent. Though these are very simple things which you can do at home, just changing your lifestyle. So first is doing regular exercises. It is for all age group, for the ones who are, for the adolescent, for the young people, for the pregnant ladies, and also for the perimenopausal and the menopausal age group. Depending on your age group, you can do your various exercises. Like adolescents, they can go for heavy exercises, they can go for cardio. Now, what happens with exercises? Your exercise it's a very good stress buster. It will bust your stress and it will increase your mood, it will improve your mood. So with exercises, endorphins are released. Endorphins are also a kind of hormones. Now this endorphins, they are like happy hormones. They help you to think positively, they make you more happy, so they regulate your mind. So stress, so doing exercises is, we just think that it is only for physical health. It's not like that. It will help to improve your physical health as well as your mental health. Even,
Very, very important. Very true. Very true.
yes. So puberty, so adolescent people, they can do heavy exercises. For reproductive age group, they can do exercises as per their choice. Now for pregnant ladies, you know, they can do low impact cardio exercises, like walking, swimming, go out in fresh air. Then for perimenopausal and menopausal women, depending upon how their health factors are, they can take help of a trainer, of a expert, and accordingly do various exercises, which will help them to, reduce their stress levels. So once the stress level reduces, the stress hormone, which is cortisol, it also reduces, and it helps to, it does whatever work it has to do, for whatever it has to do, but it won't overwork and it won't cause you harm. So that is very important. Exercise. Next is eating healthy. Now, eating healthy is, whenever we say eat healthy, it is not always weight loss. You have to have a holistically good diet, like appropriate in your carbohydrates, appropriate with your proteins, fibers, multivitamins. Everything should be there in your diet. Now you should cut down on your sugars and refined carbohydrates. Refined carbohydrates like maida, and then white bread, then sugar, refined sugar. All these things should reduce. Now, why so? See, the liver is the organ in your body which metabolizes your sex hormones. The sex hormones are metabolized by liver. So, if there is already a lot of work on the liver, and the liver is already overworked, it won't be able to take care of your hormones, and this will cause again a hormonal imbalance. There are certain drugs also which can cause, but your doctor will look into it. But you have to take care of your liver. So in order to keep your liver healthy, you have to cut down on your refined sugars and refined carbohydrates and eat a healthy diet. A well balanced diet is very important, which is rich in omega-3 fatty acids. Okay. Then the next is stress management. How do you manage stress? Now there are many platforms coming on online regarding stress management, how to manage your stress. So there are various ways. Okay. One of them is meditation. You can do meditation. Meditation does not necessarily mean something related to religion. It is not something which is, you have to, be of a particular religion. Meditation is to connect with your own self, to connect with your own spirit. It will help you a lot to reduce your stress levels. Then we have a very ancient, age-old technique, yoga. So our PM is also promoting a yoga, and now we have an International Yoga Day also. So we all have agreed how important yoga is for all of us, and it is indeed important for your physical health as well as for your mental health. If you practice it continuously, it is going to definitely help you throughout your life. Even if you do it now, you let skip in between, it will help you in future also. So you practice yoga, it will help you to reduce stress, it will help you in your maintaining your physical health as well as mental health. Then is other techniques like listening like good music, good soothing music. Then breathing techniques. There are various breathing techniques also which help you to reduce your stress levels. And last but not the least is to get a very good sleep. Getting a good amount of sleep is very important. So it is said that you should get at least 8 hours of sleep. And sleeping is important. It will affect your physical health as well as mental health. At the same time, there are hormones which are secreted during the night time. So if you are awakened at the night time, then these hormones again, it is going to affect all the hormonal status in your body. So getting a good sleep is very important to reduce the stress levels and to keep your hormones in check.
Thank you, Dr. Vaishali. So quickly iterating what you said, we have to go for exercise and yoga, go for good nutritious food, go for meditation and breathing techniques to feel better, manage our stress, and having a good night's sleep. Because it's a fun fact, I did not know that there are certain hormones excreted even at night. So sleeping is for 8 hours is very important. So thank you for sharing that.
Especially for the adolescent people. For them,
Right.
it's very important to get a good sleep. And it is this time only that they tend to remain awake in the night. Maybe for
Yeah,
study,
that's
for
true.
some other things. Nowadays, they're playing a lot of games. That's why they're awake. So they have to take care of this.
Yeah.
Parents
That's always, whenever if I may add, that
Yeah.
sleep, when we talk about sleep, everybody thinks it's a number of hours. It's not only the number of hours, it is also the time, because
Yeah.
the body cannot recognize sleep beyond a certain time. So that time is in the night, during the night. So it is not the sleep which the body recognizes and sleep and rejuvenates its cells and its hormones and bring them back to levels, are not the same when you're sleeping throughout the day versus when you're sleeping throughout the night. So that is a rhythm that the body clock follows. Now that rhythm is science. We cannot deny it. So, whatever Dr. Vaishali has given a very, very good insight on the lifestyle things. The bottom line is that with these lifestyle changes, the same hormone will respond differently with you. So it will not reduce the stress around you, but it will reduce the stress inside you. It will give you a positive stress response, a response to the same stress around you in a different way, which will calm you down. So this needs, as she said, a holistic approach. It's not like, people will think about what will yoga do to reduce my stress. It is to reduce your stress response. So that is very important.
Yes.
So we just heard Dr. Sudeshna and Dr. Vaishali talk about the role of hormones in women's mental health. So as a psychologist, Rhea, what is your take on the same thing? Do hormones have a major role in your clients? Like you've had any experience where it was a hormonal issue and people assumed it's a mental issue or it's something that was impacting their day-to-day life and they've come to you for consultation?
Of course, I've had a couple of clients that came in with mood swings and struggling with managing their emotions on a daily basis. And it turned out that, sure, they needed some support with regulation, but actually it turned out they had PCOD, and it hadn't been diagnosed because they had no other symptoms except the mood swings and, of course, the painful periods. But hormones basically run feelings. So without hormones, we wouldn't have feelings. So there's no doubt that they walk hand in hand.
Right. So, what, according to you, again, like if somebody is having these mood swings and women particularly go through, as Dr. Sudeshna and Vaishali said, a lot of stages in their life where these hormones are sometimes aggressive, sometimes playing different fluctuations are happening in different stages of life. So, how important it is to talk about women's reproductive health, hormonal health, and mental health to men in the house?
Oh, it would solve a lot of problems if we were able to talk about these things out loud. I think men need to understand a lot about these experiences that women go through. I think it also helps them to feel like they can also have feelings, because I think often feelings are the privilege of women and men don't get to have any that isn't anger or disgruntledness or frustration. everything else falls to the woman. And I think things are also not taken seriously because often it gets dismissed as you're being hormonal. So I think it's really important to understand how these things work in the body for everybody. And to be a little more sensitive, we would have a lot less conflict, I think, and a lot less bullying also in schools and stuff. So I think the more we talk about things, the less power they have to hurt us. And these are natural processes that women go through, but they end up being ridiculed for it. But it's also a superpower. So it's important, I think, to be able to talk about these things to everybody. And the more you separate that only men can know this and only women can know something, it creates imbalance and it creates conflict. And it creates a difference that really isn't necessary.
Couldn't agree more. So that leads me to my second question from you, that as a young woman, if you see your elder sister or your mother or any other elder female struggling with these issues like hormones and mental health, like what should be your response?
Well, I think if you have knowledge that the adults, the older people in your family don't, it's really important to pass on that knowledge as best as you can without being patronizing, because a lot of the older generation don't have the opportunity to have learned what we now know. A lot of things have come up in the last 10, 15 years that we didn't know about women's bodies and reproductive health, which is a whole other conversation. So if you have that knowledge and you can see that they are struggling, I think it's really important to try and help them understand that mental health is exactly like physical health. If you can get a fever, you can also have hormonal fluctuations that are going to affect your mood. A simple example that I always give my youngest clients is that if you think of someone that you like, you get butterflies in your stomach. So your thoughts and your feelings are actual physical responses. And I think if you can help them understand that and help them understand that there is no need to continue to suffer, I think there is a general understanding that women need to suffer through things. They don't. There are options and there are ways to address this. And a lot of the issues that come up because of hormones are lifestyle related. So it's really important to meet your gynecologist and try and help the women in your family as well to go ahead and do the same and to empower as many as you can, because knowledge is power.
So thank you so much. I think that comes to the we come towards the end of the panel, and it was great having you here and hearing to your views. And any last recommendation or word of advice as experts you would like to share with us before we wind up?
Vaishali?
I think we should make people more aware about the hormonal changes occurring, affecting your mental health. The young ladies, the young children coming up, even though, the older ones. We all should be aware, not just blame somebody that, oh, she's behaving like this, she's behaving like that, she's very cranky or like that. Everybody has to be made more aware about this thing, that mental health depends on your hormones also.
Yeah. And importantly, the men around
Yes,
you.
yes.
It is important to not only the women getting aware, it is important for the men around the women, handling the situation has to be made aware, whether it's a husband, whether it's a partner, whether it's a son, brother, father. They need to be aware of these things, that certain things are not in the control of the women. So my last words of advice as an expert in this field and dealing with these women so many years is that first comes acceptance. Accept the changes in life, accept that there would be some physical as well as emotional changes in life. Be aware when you need to seek help. And the third is, do not hesitate to take help, be it in form of expert advice or be it in form of interventions, specific interventions, which includes medications.
So actually, I'm of the opposite opinion. I think that when it becomes hormonal, it becomes medical, it almost becomes more acceptable. At least that has been my experience. The stigma will continue because across the board in our culture, we have this idea of you keep things within the family and log kya kahenge. So it becomes more focused on what the social impact of you having an issue is going to be rather than your actual experience and suffering. And every time that particular refrain is used, what you are communicating to the person that is struggling is that someone's impression of you is more important than your daily experience, which I'm obviously not on board with. I think it's really important to let people know that they are important and what they don't have to keep going through what they're going through. But the minute, and I have noticed this, and it is a word of caution I also would like to give, that the minute you have mental health and hormonal issues walking hand in hand, often, even if there are other underlying mental health concerns, they will get brushed aside because now we know it's hormonal, let's just pop a pill and let's just sort it out in that way. But the thing with mental health stuff is eventually it keeps popping up in its own way if it's not addressed. And as far as stigma is concerned, like I said, it's just inherent in our culture, and I think we just need to keep talking about it and normalizing it because it is normal. A lot of it is extremely normal, and let's be honest, we've just had a global pandemic. It's been almost a global trauma, and a lot of people have had a lot to deal with. So I think please keep talking about it. Let's normalize mental health. And yeah.
Thank you so much. I think that was a very insightful session titled Women's Mental Health is linked to hormones, and you guys have already shown how and how to deal with it. So I hope this session was really useful for everyone who is watching us. And we start with acceptance, create awareness, and khul ke पूछते हैं, बात करते हैं on mental health and on hormonal health. Thank you so much.